My name is Brett Boyum, and I'm a veterinarian with Riverview, and going to go through a little bit with you about calf care during your 4-H summer projects. Some of you probably have been through this program already before, so it may be kind of a refresher. For some, it may be the first time through. So looking forward to, if you guys have questions, we can certainly communicate as you're working through the projects, either with Natasha or myself as things arise. But again, my name Brett Boyum. I grew up in Battle Lake, so about an hour north of Morris on a dairy farm there. And myself was a clover bud and grew up showing calves and working in the dairy world, FFA, 4-H, etc. throughout my career in high school, and then moved on to college at the University of Minnesota Twin Cities and got my animal science degree and stayed there for another 4 years and got my College of Veterinary Medicine degree, or my DVM, Doctor of Veterinary Medicine. So I graduated in 2014 and moved a little bit back, kind of closer to West Central Minnesota, back to the Alexandria area. And this was my big red vet rig that I ran around the countryside doing dairy and beef work for client farms, working with everything from calves to cows, working with herd health routines or emergencies as they would arise. Spent a little time doing small animal care as well for dogs and cats, but then recognized that I wanted to be in dairy focused production medicine for the remainder of my career, which was the goal all along, and had the opportunity to join Riverview back in 2017. And so now I'm a dairy production veterinarian with Riverview, and excited to be here with you guys today. Want to talk to you a little bit about just general veterinary careers that people think about. Generally, the first one that comes to mind is private practice. Like I had in my first job, when you're working with clients, seeing patients, doing emergency work, potential just routine care, helping farmers improve their businesses. That's the private practice, and probably takes up their biggest component of veterinary medicine throughout the country. That being said, there is a lot of other opportunities within veterinary medicine as a whole. So from teaching and research in a university or some sort of private practice setting where you're focused 100% of your time on research, regulatory medicine, where you're spending time making laws and helping to improve veterinary medicine governance and improving through that way. Public health. So as you, in 2020 right now, when we're dealing with the coronavirus outbreak throughout the world and throughout this country for sure, public health and veterinary medicine go hand in hand as diseases spread between animals and people, and improving that through public health is certainly an option for veterinary medicine. Uniform service, here again next, would be in the military branches. There are veterinary opportunities where you're potentially taking care of animals that are working for the military, or also doing public health related matters within the military branches as well. Industry would be the next one, where you're working for a pharmaceutical company, potentially some other feed company or company along those lines, where a veterinarian would provide opportunity to those to serve their clients and support their products, or to support their business. The last next two here, the last one would be a farm veterinarian, similar to what I'm doing, where I'm working for a specific dairy farm. We have a veterinarian or veterinarians on staff, and working with that one client and helping to improve their processes and routines and production in that regard. And then the final part, zoo medicine. Zoos and other places that would be in the zoo category have veterinarians on staff, care for the animals. It's a unique, different aspect of veterinary medicine, but certainly I think you can get a wide appreciation of what veterinary medicine can look like here. It doesn't have to be the traditional setting in a traditional practice. There's a lot of opportunity in veterinary medicine, and that's really what drew me to want to be a veterinarian as I learned more about it. And the question becomes, okay, I would like to kind of explore veterinary medicine. What does that look like? What do I need to do to get there? And the short answer, it's a lot of work up front. But I think just like anything, if you put a lot of work up front, the reward is definitely worth it. So I went to, this is just a map of all the veterinary schools in the United States. I went here again to the University of Minnesota, and there are veterinary schools generally throughout the country. However, as you can see, all the green states here do not have a vet school. Aside from Arizona, does have a new veterinary school that has recently started. So there are veterinary schools throughout the country. Generally speaking, you need 4 years of undergraduate, so you'll need some sort of animal science, biology, or some other science-related degree, and then 4 years of veterinary school after that. So 8 years in total, so it's definitely a commitment. And beyond veterinary school, you have the option to do a residency, an internship, a PhD, something along those lines. Just like you would in human medicine, you can advance your degree that way. I will say that's less common probably in veterinary medicine, but certainly there are areas specifically in research in university settings where those advanced degrees are common. And just as a note to anyone or everyone, that the average cost of earning a veterinary degree in 2020 is $250,000. So as you look and explore careers in veterinary medicine, just know that there is a significant time investment as well as financial investment. So I think it's really important that if you want to continue being a veterinarian or going down that path, that's awesome. And I would highly encourage you to do that. Just be aware of what you're signing up for. And this website right here, iwanttobeaveterinarian.org, is actually a really nice resource to start exploring what that can look like. And as you ask the question, how do I prepare within high school and further on in college to become a veterinarian? A lot of it comes back to foundational math and science classes. It's a lot of math, science learning to kind of get you set up for anatomy, biology, physiology. All of those things are rooted in the basic science learnings that we start learning in high school. So if there's a potential to kind of shorten up your total track with, if your school offers college courses, that's an excellent way to do that, as well as getting experience with different types of animals, shadowing veterinarians, volunteering, or getting work experience on a farm, somewhere along those lines, so that when you're working with animals, you can actually say, yep, that's what I want to do. Or there's a lot of other careers within agriculture that are not veterinarians that can be great for you if veterinary medicine is not your thing. Also working on communication and leadership skills. 4-H, FFA, other youth organizations are really great, specifically 4-H in this regard, about helping young youth develop leadership and just general work ethic and behavior as you're working with animal livestock projects specifically. And then as you move into college, more math and science, as I mentioned before, veterinarian animal experience, continuing to learn that through clubs and activities. And then as you further your work experience through internships, another great way to kind of test the waters of veterinary medicine and see if that's right for you. And so when we look at veterinary medicine as a whole, it really kind of breaks down into 4 categories that one generally spends time thinking about. So prevention of disease, making sure animals never get sick. Treatment, so when an animal does become sick, what do we need to do to help them recover? And then research and development, what are future opportunities to either prevent or treat disease altogether? And if we don't research it or it doesn't become developed, we'll never know about it. So that's something that private practitioners do a lot of research and development. Certainly we do here at Riverview, spending a lot of time trying to figure out and fine-tune opportunities within our dairy and beef farms. And then lastly, public health. Are the things that we're doing affecting the environment, affecting people as a whole? And we want to kind of keep these 4 things in mind as we're working through veterinary medicine. Just real basic on differences between how animals and people, for that matter, are getting sick. Germs, as we kind of dub them in simple terms, but bacteria is a bacteria that can infect people or animals. And an example of in people is when you have the stomach flu. Maybe potentially you ate something bad that had a bacteria on it, or in the case of a cow, an infection of the udder that is called mastitis. So a bacteria can enter the udder, cause an infection. It can be swollen, it can be hard, it can be painful. And so those are common signs of a bacteria infection. The next would be a viral infection or a virus, similar to the flu or, again, the coronavirus, are two viruses that can enter commonly your respiratory system. You can also have viruses that enter into your digestive system, so stomach and intestines, but that would be influenza, again, in people, and then infection of the lungs, more commonly called pneumonia, where you can have a virus that it enters your nose, enters the cow's nose as well, infects the lungs and causes coughing. And we'll talk a little bit more about those two things in specific there a little bit later. And then next would be a fungal infection. So think about mold on your bread, where you're going to have that potential. If you would eat that mold, it could cause a fungal infection. Animals, specifically 4-H animals, it seems like every summer there is a ringworm specific challenge that we have throughout the summer. And so ringworm is not an actual worm, or it would fall into the parasite category here. It's actually a fungus. And so it's a similar thing to athlete's foot, if you're familiar with that. It's the same type of fungal organism that can affect cattle. It's not transferable. It can be transferable to people. And so that is what we call a zoonotic infection, where it can be transmitted from animals over to people. And so lastly here, an example of a parasite. So lice, people can get lice as well as animals. And then tapeworms. Tapeworms can infect more commonly animals. Cats and dogs certainly can see it in cattle as well. But all these parasites listed here on the bottom are more commonly transmitted between animals and people. And again, that's what we call a zoonotic infection. Think of zoo, where animals and people get together, and unfortunately those things can transmit people to animals sometimes. So common illnesses of cattle, and what you'll be kind of wanting to watch out for as you are working with your calves and potentially heifers or steers as you're working through the summer. I will say typically in younger calves, so calves probably less than 4 months of age, we're going to see pneumonia as probably the most common cause of illness. So that's in the respiratory tract. So in this cow diagram here is the lungs. So relatively large lung capacity. Here is the line that we draw, actually where the diaphragm is, and everything in front of that is the heart and lungs, or the thoracic cavity, and everything behind that line is the abdomen, or the digestive part of the animal. So that's the next common one. We typically see it more often in calves that are probably 2 months or less, where we're seeing diarrhea. Issues certainly can happen in older animals, calves and cows as well, but a digestive problem, manure is runny, liquidy. It's not formed correctly because it's what we've eaten or what the cow has eaten is moving too quickly, and it's not being digested properly. So again, here's an example of that digestive system kind of outlined in this calf here. So we've got the stomach, which again has the 4 compartments: the rumen, reticulum, omasum, and abomasum. It's not 4 stomachs, but it's one stomach with 4 separate compartments that all kind of have separate jobs and functions. And then the ingested material will pass through the small intestine into the large intestine and then be defecated in what we see as manure. So that's the digestive system in a quick summary. And then specifically in adult cattle, the udder, when it becomes infected, certainly can have what we call mastitis. So an infection of the udder would be mastitis. And the udder, interestingly, has 4 separate quarters, which we see as 4 teats. and each quarter is kind of kept independently. So one quarter may become infected here, but the quarter next to it will stay, generally speaking, not infected, unless we transmit the bacteria as people from one quarter to the next. But internally, the cow will not spread throughout the entire udder because it's kept also in kind of 4 separate compartments. And what we see there are common symptoms of milk clots. So the milk may be curdled or maybe chunky, for a simple term there, as well as the quarter may be swollen, maybe hot to the touch. And in any of these illnesses, you may see where the animal is not wanting to eat. They're just not as active. They're just generally affected overall. And so those would be kind of 3 common illnesses that we would see. And most commonly, I would say for your calves, we're probably going to be wanting to look out for signs of pneumonia as these calves are being raised throughout the summer. So farmers and veterinarians definitely work together to help, again, prevent disease, primarily is what the goal is. Any farmer in their business is going to want to be as profitable and successful as they can be. And so when it comes to herd health, being able to prevent a problem is a lot easier and generally speaking more cost effective than treating the problem. So what we think about in terms of prevention is vaccination strategies, and then ways to help keep the environment where the animals are housed clean and comfortable, dry, out of the elements, things like that. So as you're raising your calves this summer, think about where that calf is being housed. Is there a clean, dry hutch or somewhere for that animal to be at? And then changing the bedding frequently so that we can be keeping the calf clean and dry and preventing any potential challenges. So it may feel like chores or work that you need to do, but a great way to think about it is what you're doing is helping prevent that animal from becoming sick potentially, and giving it the chance to grow as best as it can and truly provide a great opportunity for that calf. And then if an animal does become sick, we often think about supportive care. And so that's when, just like you or I, if we were to become sick, we often don't want to eat. What we do want to eat is kind of just bland, basic foods. That's similar for calves as well. So being able to provide good, clean, fresh water, a good feed source that they'll want to eat, and be able to support anything that is potentially challenging that calf. If there is a fever, significant cough, we'll talk a little bit more about kind of when further treatments would be needed here a little bit later, but an antibiotic certainly can be a tool. It's not used always, but it can be a tool to help treat an infection, just like you or I. If we have an ear infection or a respiratory infection, there may be an antibiotic prescribed by a doctor. That would be the similar case with veterinarians and farmers as well. But at the same time, if you or I go in for influenza, if we have the flu, that's a virus, and viruses are not treated by antibiotics. So we want to be mindful of when and how we're using those antibiotics to make sure when we are using them, they're as successful as they can be. And then any treatment needs routine monitoring. So once a treatment is initiated, we need to help kind of nurse them along in terms of making sure that day to day, potentially throughout the day, multiple times, we're checking in on that calf or that cow that may be sick, making sure that they are healthy and improving in those regards. And so that routine monitoring, think about a nurse that's at your bedside, checking in on your vitals and taking your blood pressure, things along those lines. What they're doing, if you've ever been hospitalized, is to try to help routinely monitor you to make sure that you're improving and not getting better. So stepping back to vaccines a little bit, again, they're used to prevent or reduce illness. We're not potentially going to prevent everything, but hopefully if you are vaccinated or if a cow is vaccinated, they will have a less severe infection than if they weren't. So those vaccinations, again, will be given up in the neck region. And we do that because a lot of these animals will be destined for human meat consumption. consumption. And we want to make sure that when that does occur, that the meat that is throughout the animal is in really good, high quality fashion. So we want to be able to give our vaccinations in a beef quality assurance kind of approved area right here. And so that blue triangle is where we're going to be giving subcutaneous injections. It's kind of the larger area there. And so that's going to be subcutaneous injections between the skin layer and the muscle layer. That space in between the skin and the muscle is what we call the subcutaneous area. And a lot of our vaccines and treatments are going to go in that space. If we do need to give a vaccination or a treatment in the muscle area, that's going to be a little bit smaller triangle, but that's that green kind of shaded triangle right here. And so that's going to be where we can give an intramuscular injection. And that's going to just be seated right into the muscle with a needle. Just like if you or I think about getting a vaccination in our arm, they're giving that up in the top muscle of our arm. And then the last kind of common vaccination is an intranasal vaccination. Again, people have an intranasal flu vaccine. We also have a respiratory vaccine for cattle that kind of sprays a mist up in the nose of the cow, and it's absorbed that way. So that's how the three kind of common ways we're giving those vaccinations. And then in this picture below here, you can see this veterinarian is drawing up a vaccine, and the calf is in a headlock with its head tied over, and it's free to move its body about back here, but the head and neck are restrained properly so that we can give that vaccination again in the correct area of the neck. And then it's less likely to be bruised or causing any problems within that calf. So as we step into antibiotics, just want to talk through that a little bit with everyone here. So if you look at your graphic on the right-hand side, this chart talks about the three kind of common types of antibiotics in really the market today. And so there's one where humans and animals could use the same type of antibiotic. So if a person goes to a doctor, they may prescribe the same antibiotic as a veterinarian would when they're working with cattle or other species. So that class is what we call a shared class, where a human or an animal may be receiving the same type of antibiotic. Now the volume, the dose, or the way it's administered may be slightly different, but the antibiotic itself is the same. Human-only antibiotics, these are kind of more high-powered antibiotics, things that we think about for humans only, so that when humans do become sick, they have something that's never been administered to an animal, and it may be only specifically, it may only work or target infections that are in people and we don't actually see in animals. So that'd be kind of a human-only category of antibiotics. And then lastly, animal-only category of antimicrobials or antibiotics as well, that are administered only to animals, again, because we maybe only see work. The antibiotic is only effective in animals. It may not be effective in people, but for some reason it's only going to be given in an animal. So again, looking over here, we can see that there are three different types of specific antibiotics. So a prescription, a veterinarian may write a prescription similar to how a doctor writes a prescription for people. That antibiotic is going to be dispensed through the veterinarian and given to the farmer, or the veterinarian may give the treatment themselves. So that prescription is going to be given. It's authorized through a veterinarian and that farmer relationship. And then we have over-the-counter antibiotics. That class of antibiotic is becoming less common, where it's not as likely that you'll go to a feed store or a supply store and be able to buy an antibiotic over the counter. But certainly there are other over-the-counter treatments, like you or I would go to a pharmacy, potentially get a decongestant or an antidiarrheal, Pepto-Bismol, something like that. Those products are certainly available over the counter. The antibiotics are becoming less and less common, just because of control and general desire to have a veterinarian more involved in the treatment of antibiotics in general. And then, so the last kind of category is feed grade antibiotics. And through the veterinary feed directive, which has kind of come about within the last 5 to 7 years, that is where antibiotics that are fed through the feed, you need a special prescription, which is what we call a VFD. And so that the veterinarian has prescribed how to give the antibiotic or the treatment through the feed. So when we look at routes of administration, the injectable or oral routes of administration are going to be similar to what you would see with people. So you'll get an injection. You may take that antibiotic in terms of an oral liquid or something with a drink. More common probably in younger kids, that just injections are not going to be common that way. And then feed-related antibiotics are again going to be administered through the food with this common type, the VFD, where that's going to be mixed into the feed and it's going to be given for 3 to 5 days or some sort of defined period of time. And treating a larger group of animals is typically how that's going to be presented versus trying to go and give injections to specifically one animal at a time. If the entire group is sick or we think they're beginning to become sick, we may want to give an antibiotic or some sort of treatment through the feed. So kind of lastly here, you will have a link to this specific kind of health scoring guide that you'll be given when you pick up your calf. But I just want to step through this with you, and you can certainly come back and reference this later as you have situations that may or may not be arising with your calf. But just know that you will also have a kind of a hard copy to reference throughout the summer as you're treating your calf. So how we read this is there are 4 columns, 0, 1, 2, and 3. And as you move from left to right, everything on this sheet becomes more severe as a 3 compared to a 0. So think about 0 being kind of normal, where we take a rectal temperature in that 100 to 100.9. That's going to be in the normal range. No cough. There's no discharge coming out of the nose. The nose is clean. There's nothing going on in that calf that we can see in this regard. And as we move over to the right, the 3 where we're going to be kind of the most sick is you're going to have a high fever, coughing repeatedly, spontaneously, and you're going to have a lot of kind of in both nostrils, kind of mucus discharge that's coming through the nostrils. And so that may happen, but what we want to try to focus our efforts on is this 1 to 2 area, because if we can catch symptoms or things that are occurring in our calves more quickly, our treatments are going to be responding better, and we're going to have a better chance of success in terms of that treatment. So focusing in on looking for calf signs that are in this 1 to 2 area, kind of subtle, maybe have a slight increase in temperature. There may be kind of single sporadic coughing or a few coughs that would be considered a 2. And then you may have a small amount of discharge in kind of one or both nostrils. But if we're seeing disease, we want to kind of focus it in on trying to find it and identify it here in the 1 and 2 category versus waiting until the calf is really sick out here as a 3. Similarly, when we look at eyes, the 0 is going to be kind of a bright, alert, clear eye. There's no real discharge. Again, we're going to see potentially a small amount of discharge here in a 1, slightly more in a 2 score, and then a lot of heavy discharge around the eye when that calf scores a 3. Again, we're looking at ears here. So a normal calf is going to have its ears up, bright and alert. It's going to be kind of responsive to what you're seeing normally day to day. If there becomes an ear infection, you may see it kind of flicking that ear, kicking at that ear. One ear may be drooped, would be a sign of 2. And then 3, you may have a calf that tilts its head because there's pressure on that ear and they're trying to take that pressure away. Or you may have both ears kind of dropped and that calf is going to be pretty sick at that point. And then lastly here on the manure scores, we're going to be looking at kind of normal formed stool. That's going to be kind of normal. And then as we move 1 to 3 again, it's going to become more over as a 3, highly liquidy, kind of doesn't stay on top of the straw or the bedding and kind of sifts through. You may notice that where they're sleeping or where they're spending their time is going to be a lot more dirty just because they are defecating more. And so that runny liquidy manure is going to be a score 3. A score 2 is slightly more formed. And then again, a score 1 would be kind of a pasty type of manure. So as we go through and score these calves, I would recommend, as the calves are nice and healthy, getting used to what that calf looks like normally day to day, because that will help you signal to when infections may be occurring or when they're not as active. So if you have a really good sense of what the calf looks like normally, you'll be able to start picking up subtle signs. And if we ever add up all the scores from when we evaluate a calf and we have something 5 or greater, we're going to know that there's probably a respiratory infection going on there, and an antibiotic may be justified, or for sure we're going to want to be taking careful care of how much they're eating, how much they're drinking, and what's their activity level looking like. May be able to just kind of monitor it for a couple days, but then if it's not improving on its own, we're going to want to get someone involved, a local veterinarian or someone to help us find the right treatment for that calf. So just 2 quick examples here. One, this calf on the left-hand side here, you can kind of see the ears are drooping, the neck is extended, it may have a fever, probably also has a cough, the eyes are kind of dull, skinny, where it maybe have been occurring for a while, and maybe it's breathing fast too, we're not sure, given this specific picture here, but I would score this calf a 6. So I would definitely want to be thinking about, do I need to provide additional treatment, or do I need to be, definitely keeping a closer eye on this calf to make sure that it's not progressing any worse than it already is. And then also just keeping that kind of normal calf in your frame of mind, bright and alert, sitting up, responding appropriately, and appropriate body condition as well. They're eating and drinking well to stay hydrated. So those are kind of just a couple simple examples. I encourage you to kind of take that sheet, use it regularly, evaluate your calf, learn what normal looks like, and then certainly ask questions if you ever have a calf that you're thinking maybe coming down with something. So any questions?
Yeah, I have some questions. So as I listened to you, Brett, I thought, well, if I was a 4-H'er, what are some things I might wonder as I actually have a calf at my house to take care of? So first of all, let's talk about, in general, like, what do you think is going to be the couple of things that you really think people should watch for that are the most common, most typical, probably what they're going to see? And then if you could also talk a little bit about then when do they need to call us?
Mm-hmm.
And when do you wait? How long do you wait? Because it can be a slippery slope if you wait too long. Right.
Yep. Good questions. So I would say as calves, they're going to be a couple months old. They're going to be you may see a little bit of diarrhea, would be kind of one thing to be watching out for. And as calves transition to new environments and new feed, some loose stool may be common, but as you get it to where it's happening longer than, I would say, 2 to 3 days, that's probably a good sign that there is a normal active infection going on. And you may want to take a temperature, so it's a rectal temperature, to see if you have diarrhea plus a fever. We're going to be wanting to make sure to give electrolytes therapy as well as making sure that that calf has plenty of feed and water available. And if it's not getting better within a few days, for sure within 5 days, I would say, that is when I would get a veterinarian or someone else involved. If the eyes are looking really sunk in or just not being active, certainly call sooner. But on diarrhea, that's what I would do, kind of that call 3 to 4 days later and just check in if things are not improving, especially if you've given fluids or electrolyte therapy. So that's going to be when you want to give those treatments. And then on the pneumonia side, so that may also occur, and you're going to hear a cough from the calf, specifically that may occur. And then you'll see that nasal discharge that we talked a little bit about. Those respiratory infections they're not always, but they tend to be less dramatic and severe up front. So if that calf is having a cough for 3 to 4 days, I don't get too worried about that, but we want to make sure that their environment is clean. They have a dry place to go lay down and kind of stay out of the elements. So making sure that their environment, again, like we talked about, we're preventing disease or infection. So they've got a clean, dry place to lay down. We're changing that bedding often, and then watching for signs of cough, nasal discharge, kind of that sheet that we talked about. And if that's a temperature running over 101, 101 and a half, and cough, respiratory signs like that, we're probably going to want to be thinking about having potentially a veterinarian or someone with experience diagnose pneumonia, and maybe there's an antibiotic or other treatment that we should be giving at that point. So generally speaking, both things I'd be thinking of within that 3 to 5 day range. If things are getting worse or dramatically getting changing day to day, we're going to want to get someone else involved.
Awesome. And we really want to encourage all the 4-Hers that you can call anytime, email. We'll give you all that info. If you are even just wondering, call, because if you don't have the background in caring for livestock, or your parents don't either, there is never a bad question, never a dumb question, ever. We have livestock, and I ask lots of questions.
Right. I would say if you're in doubt, certainly reach out and ask questions, because the last thing, like you mentioned, Natasha, is to wait too long, and then we could have been potentially more successful if we would have just asked sooner. So if having questions, ask for help sooner.
Mm-hmm. And we love getting questions, so you're not bothering any of us. All right. So my next question is, how do you take the temperature? We're going to provide everyone with a thermometer. If you've done this program before, you already have one, but if you need a new one, we need to know that. But how do you do it?
Sure. Yep. So when I would say, if you have a headlock or if it's on a rope halter and you're able to tie up the calf, that would be best to try to restrain the calf. And then I typically will either, depending on the size of the animal, again, it's going to kind of dictate, but you'll want to restrain the calf either up against the wall or potentially between 2 people if the calf is small enough where it's not going to throw 2 people around. So take the tail, lift up the tail, and insert the thermometer in the rectum. You don't have to wait for the animal to defecate or poop or anything. You can just slide the thermometer in. You may want to use a little bit of water. Maybe if you have mineral oil, you can even just spit on the end of the thermometer just so that it slides in easier. And then you'll take the temperature, let the thermometer beep, or get to a point where it's not, the temperature is not running around, and it's kind of stable. And so typically 20 to 30 seconds, insert the thermometer in the rectum, and the temperature will be given on the digital readout there.
Awesome. And I know for us, if we ever just wonder, ooh, is that animal feeling okay? We'll just take the temperature, because it'll tell you pretty quick. Like if there is a problem and it is running the temperature, you will know. And then it kind of confirms that you might actually have an issue, so that you can.
Right. Yep.
Yeah. Okay. And then what vaccinations likely are the animals that these 4-Hers going to get in the lease program? What kind of vaccinations were they given, and what are the general things we worry about with cattle for vaccinations? People get vaccinations, and different species get vaccinations. So, what are kind of those general ones that likely these animals have had?
Yep. So these animals will have had the intranasal vaccination that we talked about, and then they'll also be getting the respiratory vaccination. That's an subcutaneous vaccination in the side of the neck. So that's going to prevent some different viruses that commonly cause pneumonia. Actually, 5 different viruses. So that's going to be one of the vaccinations that they'll be given. The other is what we call a Clostridial vaccination. So Clostridium is a bacteria that lives in the dirt. It's in soil. And there are 7 common Clostridium bacteria that we're going to be giving a vaccination for. So kind of the slang term for that is we're going to be given a 5-way and going to be given a 7-way. 2 different types of vaccinations, but if your parents or a veterinarian or something like that says give a 5-way or a 7-way, that's often what they're going to be talking about. So the respiratory vaccination is one that we're going to be given, as well as the Clostridial vaccination. So those 2 are going to be given usually twice to booster the vaccination, just like you or I, to give that booster. And then when we give that vaccination, oftentimes nothing happens, and that's what we want to see. But probably for the first hour or so after giving that vaccination, come back, check on the calf for sure. What I would encourage you to do is give the vaccinations relatively early. If you have chores or other things to do outside, be around that calf, just because it will often be some of the first vaccinations that the animal is given, and there may be a chance for a reaction. Doesn't happen very often, but it can happen. They may be getting swollen in the face, and that's something you would want to get a veterinarian involved right away if you don't have epinephrine, if you don't live on a farm and for some reason have epinephrine on hand. So that would be something to get a veterinarian involved in right away.
Okay, next question. So, first of all, what's your general advice for just staying safe around livestock? And then also, what are some of Brett, for those of you that don't know Brett personally, he does a lot of work with Riverview on animal care and how we care for our livestock every day to make sure we're the most humane we possibly can be. And Brett does a really good job at that. So what are the ways that we need to make sure that we are being kind to our livestock?
Sure, absolutely. Yeah, great questions. So first on safety, I think number 1, if you're not confident or it's your first time around calves, try to ask questions. Maybe it's your parents or a neighbor or someone that you're working with. Ask them to get, potentially maybe spend the first couple of days or just shadow them a little bit as well. But always making sure that when you're in the pen with the calf or leading the calf, the calf knows you're there. You don't ever want to startle an animal by suddenly walking up behind them where they can't see you, because cows can see all the way around except for like right directly behind them. So that's why they have, like, this cow has the eyes on the side of her head. She can see all the way around, but she can't see directly behind. So if you walk straight up behind her and startle her, she may kick, and that would probably be one of the most common things that we see. So whenever approaching an animal, approach from the side. The cow or calf will typically make eye contact with you, and you'll be able to see that, and the animal won't be startled when you come up next to the animal. So that's probably the big safety number 1. Also, when you're breaking the calf with a halter or working in the pen, you always want to make sure that you have an escape route. If something goes wrong, if the calf gets wild for some reason, you don't want to be stuck in a pen where you could potentially get pinched between the calf and a gate or calf and a wall or something like that. So you always want to make sure that you have a route that you can get out safely if something does go wrong. And then with a halter, making sure that when you are leading the calf, never wrapping the halter around your hand. It's always carried kind of loosely, because if someone runs up to the calf or hears a loud noise, the calf gets startled for some reason, it can run away and you can drop the halter and you don't get drug along with the animal. So those are probably the three things: preventing startling, making sure that you always have an escape route, and then when you're leading the calf, making sure that you're never holding the rope around your hand. You can always drop it easily. So those would be kind of three really big safety things to always be thinking about when you're working with your calf. And then on the welfare side, we always want to be doing things that we would be comfortable doing if they were done to us. So making sure that we're never hitting the calf, we're never, yelling or screaming at that particular animal. We're using proper stockmanship handling basics. There's actually a really good website, FARM, it's the National Dairy Farm Program, has a lot of good basic animal handling videos on their website, and we could potentially put a link or something like that out there if that's not there. So that would be a really good resource if you want to learn more about stockmanship, or what we call interaction between humans and animals, specifically in cattle. So making sure we're never yelling, hitting, doing something to the calf that we would never want to be done to us. And then also, more basically, making sure they always have food and water, shelter, and kind of protection from the elements. Those are going to be the things, especially in the summer. It's going to be hot out. They're going to be wanting to drink a lot of water to stay cool in that regard. So feed and water access is probably the most basic thing that we can make sure that our animals always have throughout the summer, especially water access. And then doing anything with the calf, working with them in a kind of soft, gentle way. They'll kind of pick up on that nature that you have around them, and they're going to be less startled as you and that calf kind of work together throughout the summer. So those would be the main kind of welfare takeaways that I would encourage everyone to just be calm. Sometimes it may be kind of nerve-wracking or scary, depending on your comfort level with calves. And just be calm, because that calf can kind of read your body language in that regard.
Yeah, and even on a halter, like, they can feel you through the rope. I mean,
Right.
like,
Yep.
they know what you're feeling. So anxiety or anything, like, they know. So just I think for us working with 4-H animals with my kids, we've really learned, kindness matters. They know if you make an animal afraid of you, they will be afraid of you the next time and the next time, and then you have to work backwards, and it takes a long time.
Yep.
So as far as PPE goes, a little bit of just really important things that I wanted to mention, like washing your hands, and wear gloves if you're doing the temperature and things like that, just because you can get things from poop, and just make sure that you're always washing your hands really well. We're all learning through the spring that washing your hands is a really big deal. Not touching your face when you have stuff on your hands or you're not sure what's on them. So always practice that around livestock as well. All livestock, not just cattle.
Absolutely. Yep.
All right. So my last question is, what is your favorite thing about being a veterinarian?
My favorite thing about being a veterinarian is really watching people that haven't had experience around animals really learn to be comfortable and successful working with animals, caring for animals. So this is really a great program to kind of watch that come to light as young people kind of find their passion or their desire to work with calves. So I really enjoy seeing that kind of human animal connection as a veterinarian. It's really cool.
Yeah, well, you are a fantastic veterinarian. So Brett definitely is a big 4-H'er and FFA growing up, and really took that passion growing up on his dairy farm, and really wants to help. So if you guys ever have questions, we'll have contact information for myself and Aaron Larson and Kelly over in South Dakota, but we can all get a hold of, Brett if needed. But please always let us know if you have questions. Thank you so much, Brett, for doing this video. I think this will be great. People can come back and look at it. Again, Brett showed you the different pictures of the animals and the scoring. And that will be available for you, a laminated copy. You can keep it in the barn so you can always look at that. But yeah, thank you so much. We really appreciate all your time and effort, Brett, and have fun at home.
Thank you.
Yes. Okay.
Great to be with you guys.